Welcome to live. I'm like, why are you hogging my space, bro? I need to be in the picture.
Does this look like 50-50 to you? Or does this look like I'm giving him like, a little more 60-40?
What is this 50-50 stuff? I do 70% of well, actually, no, she does 70% of the work. I do 30% of the work.
There's only one thing I don't know how to do, and luckily for
Thank
you,
God.
it's not something that...
Thank God I'm better operating than you are. Otherwise, you'd fire me and take over the practice.
So I probably do a better initial consultation.
Better HR, better
follow-up, better nutrition.
More likable. But hey, by the way, I didn't tell you this. Yesterday, a patient actually, I had two very interesting exchanges yesterday. One patient goes, I've been looking around all the surgeons, whatever, and I've been seeing your live and your Instagrams, and I chose you because of that. Because on your live, you're very, what's the word, relatable, which I'm not really, but I don't know why she said it. And you answer all the questions, and you take the time to explain, and the other surgeons were like, no. And you like really take your time and you whatever. So I was like very impressed that live worked. And then I had a lady like an hour later goes to me, this is so funny. She goes, you know why I chose you? Because I watch your couchograms. I went, oh no!
So let me give you guys some context as to what a couchogram is in case you don't know. So our lives are on our professional page,
yes.
The Sosa Clinic.
Where I take it seriously.
The couchogram is something Dr. Sosa does on his personal page.
I invent it, and someone doesn't approve of it, but I like it. Every once in a while, not too often, I'm feeling humorous, and I do a couchogram about something humorous that happened in my life, in the practice, in whatever.
Well, I guess humor is in the, like
eye
they say, beauty
beholder.
is in the eye of the beholder. Humor is in...
Yeah, sometimes, in Spanish it's called apujo. Sometimes, I'm not very funny. But I try to be. But never, ever take anything on couchogram seriously. Because I say some of the craziest things on there. Like one time I go, business is a little slow, so I'm going to do a little side gig. I'm going to start raising chickens. And I had a lady call me and volunteer to give me a bunch of young chicks so I could grow chickens. I'm like, it was a joke. It's a couchogram. I'm not raising chickens.
So, couchograms are jokes. If you want to see them, they're on Dr. Sosa's personal page. I do not endorse them.
No, she does not.
I do not. On this page, though, we are here to help you to answer your questions. So if you guys have questions, you can ask them directly now on the live. If you ask them in English, we'll answer them in English. If you don't have time to get on the live, you can always send us a DM and we'll always answer it on the following live, except this week because we lost the questions. Sorry guys. May's watching not from the office, so we don't have the questions with us. But
it's like my couchogram today. Check it out. It's about lost lists.
But we'll say hi to May because she's watching from the hospital with Abuelita. So hi May, hi Abuelita.
Where are my questions, May? Where are my questions?
We'll get to those next week since we didn't get to them today. But feel free to ask any questions on here. Como estaba diciendo en inglés, ahora en español. En esta página es una página más seria. Estamos hablando sobre las preguntas que tienen sobre cirugía. El Dr. Sosa tiene una página personal donde él a veces hace videos que no son...
Son chistes.
Son chistes.
Y no son serios, pero esto es serio.
Pero aquí, cualquier pregunta que tengan, siempre pueden mandarnos la pregunta. Si la escriben en español, se la contestamos en español. Y si la escriben en inglés, la contestamos en inglés. Tratamos de ser bilingüe. Estamos en Hialeah, estamos en Miami. Pero tenemos pacientes de todos los Estados Unidos que vienen a vernos.
Right. So usually I prefer English, but if you ask in Spanish, I'll talk Spanish. Here's a little side thing. You guys know I'm a history fan. I'm a major history fan. So I'm going to give you, because we were talking about, May, where is my list, May? This is a famous line from a Roman emperor. If anybody knows this, send me a DM because I'm going to love it. And he kept screaming, Varus, give me back my legions. Where are my legions? If you guys know the historical context of that, I'll be very impressed if anybody knows. I'm a history buff. I love history. That's one of the other little side things that most people don't know about me.
Yes. You even wrote a book.
I did. It's a historical fiction. It's a non-seller. You guys heard of bestsellers? This is a non-seller. It sold 100 copies, of which I bought 99. So somewhere
My sister bought one.
Is that who bought the one copy that actually sold? Because I bought the first 99 and it sold a total of 100 copies. So if you guys want to read a historical book fiction, read my book. But you got to buy it. I'm not giving it away.
All right. So I want to talk about, now let's talk about nutrition. And I know we've discussed it before, but I am struggling personally because I am a woman of a certain age and it gets very difficult. And I know we touched on it last week a little bit about as you get older, you actually have to exercise more.
Increase your muscle mass to maintain the same weight.
And eat less calories. And
Yes.
I understand that you're a huge proponent of it's all about the calories.
It is.
But when you're trying to really watch your calories and you need a little extra, then you have to look at the quality of the food you're eating. Yes?
Yes. So,
To help you stay full and to help you get...
okay, so break it down into components.
Okay.
The most important thing for weight loss, to lose a stored fat, stored weight, the most important thing is the calories. So it's the calorie stupid. So at the end of the day, good calories, bad calories, irrelevant. It's the total calories that matter to lose weight. Beyond that, next step is the quality of the calories. So let me give you an example. If you have really good quality calories, but you overconsume them, you're gonna be obese. If you have bad quality calories, but you underconsume them, you're gonna lose weight. So the classic example, and I think most people saw this, the young man that went on a, I can't say the name, McDonald's diet, and he lost a bunch of weight eating McDonald's every single day. Now, uniformly, those meals are not the healthiest. They're not the most well-balanced. They really don't have vegetables. They don't have... But since he was consuming low-calorie choices, at the end of the day, he lost weight, which is healthier than gaining weight. Is that a healthy diet? No. But he proves my point. It's the calorie stupid. But once you get beyond the calories, then you have to start looking at the quality of the calories. So, same calories in ice cream versus same calories in steak, which is healthier. For weight loss, they're equivalent. For health, the steak obviously has a lot more nutrients. It's high protein. It's much better than the sugar load of ice cream, which has no vitamins in it, no minerals, no trace elements. So clearly, 1,200 calories of steak is way healthier than 1,200 calories of ice cream. Nonetheless, as far as weight loss, they're equivalent because it's the calories that count. But obviously, you want to have a meal that's low calorie but better. What are things that are better? Heavily protein loaded. Steak, yogurts, certain fruits, beans, but not the sugary kind, the ones that have low glycemic index, because the quality of the calories comes in. Then beyond that is when you start looking at what called macros, you want a meal that's higher in protein, more satiety. You want complex carbs that give you more vitamins, more trace elements, better nutrients. So you can look at the quality of the diet. But for weight loss, it's the calorie stupid. First step, calorie. You have to be in a negative caloric balance to lose weight. Next step, quality of calories. So there are definitely calories that are much healthier than other calories. Some calories give you satiety. The proteins, the polyunsaturated fats give you satiety. You feel full longer. The simple carbs make you hungry. So if you're given a choice of having 1,200 calories of ice cream versus 1,200 calories of steak with vegetables, broccoli, choose the steak and broccoli. Still 1,200 calories, still going to contribute the same amount to fat and energy storage. But one is way healthier than the other one.
Very good. And I was going to ask something else and I forgot. That's what happens when you get older. You forget.
But you've been working out 3 times a week and doing well, and so you're on the step of the right thing to do for elderly people. When I get to be your age, I'm going to be the same way. I'm going to exercise a lot so I can stay young.
Yeah, but I feel like because I'm doing so much, I'm hungrier.
Yes.
So it is hard to stay in the calorie level that I need to stay at.
It is
in
definitely
order
harder,
to-
so you have to find food that causes satiety.
That's exactly
So,
what I was.
and this is
getting
one
at.
of the things that we talk about all the time. Like, not to criticize you, but because obviously I would never dare criticize you. You're brilliant. But you drink your proteins in the morning. Will you have a shake? Because it's easy, it's handy, it's good to go. It is better to eat your protein. The same level of protein in a shake versus steak and eggs. The steak and eggs will give you much longer satiety. You'll be much less hungry, much less, picky. I'm jonesing because because my muscles are asking for more energy, for more, new
Yeah,
calories.
but the problem is in the mornings I have a hard time eating food.
Right.
And in the afternoons I get very hungry.
So you gotta do what you can do for your own preferences, for your own style. But there are certain principles that apply. It is better to chew and eat your calories than to drink your calories. Mm-hmm. An equivalent amount of protein in a liquid versus protein in a meal. The protein in a meal will give you satiety longer. You will eat less throughout the day than if you chew and swallow your protein versus drink your protein. Now, the choice of drink your protein versus have a smoothie, drink your protein. Mm-hmm. But the better choice is eat your protein. Steak, eggs, things complex like that. Chicken, fish. Sometimes in the morning that's hard to do because you go for the easy things. And the easy things, unfortunately, are either drinkable or carb loaded. I mean, it's, you guys, sometimes you eat for pleasure. But for example, pancakes for breakfast, horrible. Absolutely the most horrible meal you could ever have. Why? Pure sugar, pure carbs, and then you're gonna add extra sugar because who eats pancakes without syrup? I mean, no one does that. The syrup is pure sugar. And so what's gonna happen is that's gonna spike your blood sugar. You're gonna release a bunch of insulin. Your sugar's gonna dive. You're gonna be starving an hour and a half, 2 hours later. You're gonna eat again. So these are things that are terrible. Yet the American diet is based on carbs for breakfast, cereals, toast, waffles, pancakes. Very, very bad foods for breakfast. Breakfast food should be high, dense protein. Eggs, cheese, omelet, steak and eggs. Sounds crazy, but true. Sausage and bacon, bacon and eggs and sausage, etc. High chewable protein is the ideal breakfast food. What do we eat in America? Garbage. Cereals, pancakes, waffles, bagels, pure carbs, not good for your diet, gonna make you really hungry in an hour or two. That one little change carbs to meats or to high proteins for breakfast, that one little change can significantly reduce your weight at the end of the month if you do that every morning. That's what I do. Not that I'm exactly the slimmest, but I'm no longer morbidly obese, and it's religious. I have eggs for breakfast. Eggs and sometimes turkey, sometimes chicken links,
sausage.
Chicken sausage is very good. Turkey sausage. It's when do I have carbs for breakfast? When we're out, on a holiday weekend or something, it's a treat. I do the waffles or whatever, but that's a treat. I never ever breakfast carbs.
Yeah. I mean, a lot of it is obviously trial and error, and that's part of the reasons that our program is custom, our nutrition advice is custom, because not everybody's gonna like to eat the same things. I can't eat the same thing for breakfast every day.
Right.
You can.
Right.
Absolutely. I need variety in my life.
Okay.
Is it time for a new husband? Variety.
Okay,
No.
I'm gonna shave my head, see if I get a different look or something.
But I've been trying to like that once a week now. I've been trying to do the yogurt with the berries.
Good choice.
And then I've been having half of a protein bagel with cream cheese sometimes. So at least it has protein in it versus the bagel without protein. And you can taste the difference.
Yes.
It's not the same kind of bagel.
Yeah, it's because the refined sugar in a good bagel, in a tasty bagel, is much closer to sugar than a protein bagel. But sugar is the single biggest enemy of our diet. Sugar is just the enemy of our diet, and we load up on it. We have the highest per capita consumption of sugar in the world. Why do we have the biggest obesity epidemic in the world? It's really not that hard to figure out. People are, viruses, our enemies are poisoning our food or what. No, we're eating too much sugar. We're eating too much sugar. It's really that simple. If we had the lowest per capita consumption of sugar in the world, the obesity epidemic would significantly go away. So the best thing you can do in your life is get sugar out of your life. I had the lady yesterday tell me, I don't eat sugar, I don't eat desserts. I go, do you drink regular Coke? Oh yeah, every day, 3 or 4. I go, do you know how much sugar is in regular Coke? Have you ever seen the ad that is like 16 teaspoons of sugar in a can of Coke? That's how many calories it has. I mean, it's pure candy. Coke, regular soda is candy because of the level of sugar it has in it. And she goes, well, Diet Coke is not healthy for you. I go, none of them are healthy for you, but regular Coke versus Diet Coke, have the Diet Coke. See, I wasn't dissing Coke. I was dissing sugar Coke. Have the Diet Coke. Now I won't get sued. Have the Diet Coke. Have the Diet Pepsi. It's the diet that's key. If you want to be super healthy, have the water. But I don't drink water. I only drink Diet Pepsi. So get rid of the sugar. Get rid of the sugar everywhere. In your coffee. I have patients tell me all the time, if I get the gastric bypass, I can't have my sugar in my Cuban coffee. I go, no. Get used to stevia, Splenda. Changes the taste a little, but you get used to it really, really fast because you really can't have sugar. You'll get dumping. Sugar is the single biggest enemy of our diet. We need to get sugar out of our lives. People got cigarettes out of their lives, which is good, but you need to get sugar out of your life. It's a bigger poison.
And speaking of cigarettes, I know we get this question all the time. So let's talk about prior to surgery. How long prior to surgery should you stop smoking cigarettes?
So the studies are pretty good that in about 30 days, the cilia, our airways are lined up with this little brushes. I don't even know what to call them. They're called cilia. They're basically little things that move, and they're what, when we breathe in and we breathe junk in, which we do from the world, it goes in, mixes into our mucus. Our cilia push the mucus up, we cough it out. And that's how we keep our airways clean. Nicotine, the smoke, begins to damage that, especially the particle smoke of a cigarette. And so you begin to damage that, and that's when you begin to have problems with you clearing your secretions from your lungs. If you go under general anesthesia, you'll have a higher rate of pneumonia, a higher rate of bronchitis, etc. It takes about 30 days of putting no more smoke into your lungs for them to recover. Not to get rid of the risk of cancer, but to recover the function of cleaning out your lungs so that then the risk of anesthesia, of pneumonia after anesthesia, drops. So the recommendation is quit smoking 30 days prior to general anesthesia to decrease your risk of having a general anesthesia problem with your lungs. It's not the surgery, it's the lungs that are going to be affected if you're a heavy smoker and you don't quit smoking before surgery. Now, nicotine can be done in patches, can be done in, other ways. Although, let me tell you, people say vaping is safer than smoking. Yes and no. So in smoking, when the tobacco gets burned, you get all this carbonaceous stuff that damages your lungs. You also get the carcinogens, but you get all the smoke. It's essentially burnt organic matter, and it damages your lungs badly. With vaping, you don't have that component. But the act of vaping has been shown to cause severe lung damage. They actually pulling on the vape constantly causes a lung damage that can be very, very severe. So vaping is not really all that safer than smoking cigarettes. The safest thing is don't smoke. I know it's hard to kick the habit, but kick it.
So in practical terms, no cigarette smoking
30 days
prior to surgery.
Yes. And vaping, a week or two, if you really, really have to get the nicotine, but it's better if you quit vaping.
And after surgery?
You should never smoke again. I mean, think about this. You are treating the number 2 cause of death in the U.S., which is morbid obesity. And you're still doing the number 1 cause of death, which is still smoking. Now, smoking is going to be surpassed by obesity as the leading cause of death. Why? We're smoking less and less as a society. But if you're obese and smoking, number 1 for your health, quit smoking. Number 2, get the weight off, bariatric surgery. So I always tell patients, it really doesn't make a lot of sense to have bariatric surgery and keep smoking. Because you decrease the risk of death from obesity, but you're maintaining the number 1 cause of death, which is smoking. So it's hard, but you really should do. And we have a lot of patients who kick them both at the same time. It's actually really good because they know they have to stop smoking before surgery, and they know it's bad after surgery. They manage to stop smoking, have the surgery. Now they go on this positive, feedback loop. They're losing weight, they're getting healthier, and they stop smoking permanently. And that's the single best thing you can do for your longevity, for your health, for your life is get rid of the obesity, get rid of the cigarettes. What you're getting back in life is amazing. So
you do those two things and you start exercising for your heart.
You get back incredible number of quality of life and years of life.
So let's just do a quick run through of what you can expect if you're going to have bariatric surgery. So if you're interested in having bariatric surgery, you can have a free consultation with Dr. Sosa. You can do that virtually or in person. Once you have the consultation with Dr. Sosa, you are going to have a talk with your coordinator.
So I'll jump in now and say, before you have a consultation with me, I'm going to send you a video seminar. It's very important that you see it before we talk. Literally, it takes about 20-25 minutes to explain to you, to really explain to you weight loss surgery, the sleeve, the gastric, the results, the complications. I don't have time to do that one-on-one or every single patient because I see dozens and dozens of patients. There's just not mathematically enough time in the day. So if you watch that 20-25 minutes on your own, then when we talk about specific questions, specific details. That's a much faster conversation, 5-10 minutes. And then you are informed so you can ask me informed questions. I have patients who walk in the office and I say, you see the video? And they go, no. And I go, oh. And they go, tell me all about bariatric surgery. And I go, with all due respect, I can't because it's a 25-minute conversation and I have 10 more patients to see. I'm going to put you in the waiting room with the phone. You're going to watch it. And after you watch it, then we're going to talk for 10 minutes on specific. What's the right thing for you, the right answers. Sometimes something on the video doesn't make sense. I explain it better. I give you better details. But the whole conversation has to occur after you see the video. And what's the conversation good for? Because we're going to decide which surgery matches you, which surgery do you want. Anything specifically in your history, either medically or surgically, that we need to discuss to consider the risk of the surgery, the cost of the surgery, etc. So that virtual consultation or in-person free consultations is very important to get to what do you want, what do you need, what's good for you. We both agree. Now let's set on the details.
So you watch the video, you have a virtual consultation, you talk to your coordinator, you guys deal with either insurance or financing. Because there is a myth out there that we do not take insurance. We do take insurance. It's just, unfortunately, most insurances are not covering the surgery.
And those that do, you have to be patient. 3 months, 6 months to a year to get approved.
So,
we will help you get approved, but you got to be patient. A lot of patients, we tell them, listen, it's going to be a year because that's the your insurance requires. They go, I don't want to wait a year. Okay, then you have to finance. But if you're willing to take all the steps, we will do it through insurance.
Yes, if your insurance covers it and we're part of the network, more than happy to accept insurance. We do several insurance patients every month.
Yes.
Just to give you guys an idea, once upon a time, we did probably close to 20 insurance patients a month.
Yes.
Now, we do maybe 3.
Right, because it's not us, it's the insurance company.
So we still take all the same insurance as we've always taken.
I can't operate on you until I get an authorization from your insurance company. That's a process. And a lot of patients get frustrated with us, and I tell them all the time, it's not me, it's your insurance company. They send us a list of things you have to check off. If you don't check them all off, they don't give you an off. Until I get an off, I can't operate. So it's a process, but we will help you get covered by insurance if your plan covers it.
And their guidelines are a lot stricter as far as your BMI. Some of them require that you have comorbidities. So each insurance company can dictate their own criteria on top of what is already the standard national criteria. When you go to pay for the surgery or finance the surgery, all we have to use is the standard national criteria. We don't have to go by those individual additional criteria that the insurance companies have.
Right. And a lot of times, I'll be honest with you, at the risk of getting in trouble, they're doing this because they're essentially rationing care. They figure out if we make it hard for people to get approved, a lot of people will give up. We pay for less surgery. It's done on purpose. Under the guise of we want to be thorough, we want to be this, we want to be that. What the study shows is very clear. When you jump through all those hoops at an insurance company versus you just come pay for it and have the surgery, the outcomes are the same. The success rate is the same. So when they put you on a 12-month diet or 6-month diet, it doesn't change the long-term outcomes. It really doesn't when you look at thousands and thousands and thousands of operated patients. But what it does do is it limits the amount of cases they have to pay for. But it is what it is. And if you have to be patient with them until they authorize you, you're essentially on a bit of a waiting list. But if that's how you want to do it, it's fine. We'll just walk through the steps and eventually you will get your surgery. By the way, in certain countries like Canada, UK, everybody's on a waiting list. So, here is an artificial. They don't tell you you're on a waiting list, but you really are. Because that's how they limit the number of surgeries, by making all these hurdles that they know is going to take you 3 months, 6 months, 9 months, a year to accomplish all those hurdles.
Yeah. Now there are some new global plans that are coming out.
Those are awesome.
That are working. It's like a third party insurance company that's working with like big employers. And we do take those as well, and those are really nice because the patient doesn't have to pay for anything, and it's fast as well.
So if you work for a major employer and you're morbidly obese, check with the HR department. See if they have one of those special contracts, with the special companies. We have a couple that we work with, BarryNet
and
Lantern. If you have those programs, they will cover your weight loss surgery completely. Your employer often wants you to have weight loss surgery, to have a healthier employee that they know is going to stay out of the hospital, not cost so much, in the insurance plan, etc. So a lot of employers have expedited weight loss surgery through these special plans. So if you work for a big company, check with your HR people. You might have a special coverage for weight loss surgery.
Yeah, it's in addition to your regular insurance.
Right.
Those are really neat plans.
Sometimes if you don't ask, you don't know. Yeah. But if you ask, they'll tell you, oh yeah, we participate in Lantern, we participate in
Sometimes
BarryNet.
that's why we'll ask you, what company do you work for? Because we do have a behind the scenes list of the companies that are participating with those plans. So once again, the majority of our patients at this point are paying for the surgery on their own because of these factors, because it's difficult, not because we don't take insurance. So that's a big misconception out there. We do take insurance, just not most insurance is covered. So see Dr. Sosa, meet with your coordinator, pick the hospital, pick the procedure, get your personalized quote, and then you begin the process. So you're going to see a nutritionist, you're going to see a psychologist, you're going to see a doctor for a medical clearance, labs, X-ray, EKG.
In parentheses, that can take less than a week. So a lot of patients ask me, I have to do this thing, so my surgery is in 3 months. I go, no. If you want your surgery next week, they go, really? I go, yeah. We'll do all these appointments this week and you can have surgery next week. We go as fast or as slow as you want.
Yeah. Dr. Sosa does operate 5 days a week, so that's one of the reasons we have a lot of availability in the schedule, because he is at the hospital every morning. He's got his dedicated team every morning, unless they're on vacation, which happens sometimes.
I try not to let them take vacation, but they say they have to. I don't know why. Why? I don't take. Well, I do actually. We all need vacations.
So, just an idea, because again, one of the most common questions we have is you come back to see Dr. Sosa 1 week after surgery. He's going to give you that, okay, everything is great. Most patients are back to work within a week. Most patients are driving at a week after they're not taking pain pills anymore. If you have a very strenuous job, you may need a little more time off. But most regular jobs, 1 week. And then you come back to see him at 1 month, 3 months, 6 months, 9 months, and a year. And then once a year after that. The visits with Dr. Sosa for that first year are always included with our self-pay prices, our packages, and we also include 3 visits with the nutritionist after surgery and 3 months of your multivitamins after surgery. Our goal is always so that the patients can get the most complete care. So it's not surgery and goodbye. It's surgery and you're part of our practice for the rest of your life. Like, we want to continue to see you. We want to continue to be involved with you. We love when you guys join our lives and we get to see you.
Where are all the questions, guys?
There's only 1 minute left.
We didn't have questions today?
No.
Okay, send your questions by DM so next week I have questions to answer. I love answering questions.
And not this Saturday, the following Saturday, I think it's November 22nd, we're going to have like a little health fair here in the office where Dr. Sosa will be here, I'll be here, we'll be calculating BMIs, giving some information on what diets and exercise programs you should be looking into.
I'll show you guys how to get guns. Should I bring my workout? No. I'm sorry.
We're good.
I'm in trouble.
He not only likes to answer questions, he likes to interrupt people while they're talking. We're also going to have Botox at a reduced price that day. We're going to have SkinCeuticals doing analysis of your skin. So we're gonna have a lot of great health and
come join
wellness
us.
things. And we love to see you. Our patients who have already had surgery, bring your friends. If you're thinking about surgery, you'll be able to actually see Dr. Sosa and maybe get him in a better mood that day, because we'll make sure to give him a mimosa before we start. So thank you guys for joining us, and don't forget, go
Exercise.
to the gym. Bye.